But most of the time when people are feeling sad or low, right, it's an adaptive response to loss. And it's worth taking time to grieve, to get over the shock, to learn from the experiences and plot, more productive ways forward. So Gary Taubes says we'd be healthier if we ate better and if we took fewer drugs. So Gary Taubes has been writing about this the last 20 years. He seems to have read every study ever conducted on the relationship between food and diabetes. And he seems to make a convincing case that dietary fat is being given a bad rap even before the insulin era began in 1921. So this demonization of fat, right, saying that fat is the cause of heart disease, right, that led all sorts of medical organizations to prescribe diabetic diets high in carbs and low in fat. The problem is that carbs obviously increase your blood sugar, elevate your hypoglycemia, right, exactly what people with diabetes should avoid. The solution from doctors was to take more insulin, but maybe that's not such a great solution. All right, so for a type 1 diabetes patient whose pancreas produces little or no insulin, injecting more insulin significantly increases the risk of low blood sugar, which can be dangerous. And injecting more insulin can also contribute to weight gain. All right, for a type 2 patient whose body is resisting the insulin it's already making, delivering more insulin doesn't address the body's underlying problem of insulin resistance. So the whole hero of the Rethinking Diabetes movement is an engineer turned doctor, Richard Bernstein, who had type 1 diabetes. And in the 1970s, he became the first person to use a home glucose meter. And looking at his data, he realized that a low-carb diet minimized his blood sugar, his glycemic swing.